Hello guys, I'm Kerry for those who don't know me, and today guys I'm going to drop a new video by the topic tuberculosis. Guys, before I start the video, kindly subscribe to my YouTube channel, like the video and share it wide. So I start by the definition. The definition it is a bacterial infection that mostly affects the lungs, and it is caused by the bacterial infection. It is called the Mycobacterium tuberculosis, and mainly you get it through coughing, sneezing. Now I go to the types of tuberculosis. The types, we have so many. We have the pulmonary tuberculosis, which is the common tuberculosis that most people get. We have the TB adenitis, we have the TB spinal, the TB peritoneum, the TB brain. Those are the types of tuberculosis. So we go to the presentation. Okay, sorry. Before I go to the presentation, let's go to the risk people. Okay, to people who are at risk for tuberculosis. We have those people, the prisoners. We have the overcrowding places, like in an air open market, the church. That's the overcrowding places. We have those people with the immunosuppressed people, like the HIV people and the diabetic. We also have the poor population. Those people are the people who are poor, the poverty people are likely to get the tuberculosis. We go to the presentation. We have history of cough of any duration. Previously, we were managing a cough of more than 2 weeks, but currently, any cough of any duration. We have fevers, stroke, night sweats. We have the weight loss, chest pains, difficulties in breathing. For children, those symptoms are present, and the failure to thrive, it is an addition for children. We go to the investigations. What do we request to rule out, to come up with the diagnosis of tuberculosis? First, we do the sputum for gene expert. We do the sputum for microscopy. We do the chest X-ray. Like also for those people who are suspecting they may be suffering from the tuberculosis, you have to do HIV test, the random blood sugar. You also have to do them. Now we go to the management. For the management, we have the management for pulmonary tuberculosis and management for the extrapulmonary tuberculosis. For the types of TB that I had previously spoken, the TB adenitis, that one we classify them to extrapulmonary TB. For the pulmonary TB, we go for 6 months treatment, and for the extrapulmonary tuberculosis, we go for 1 year treatment, 12 months. Now I go to the pulmonary tuberculosis. For the pulmonary tuberculosis, we have the 2 months of intensive phase, and we have the 4 months of continuation phase. The 2 months of intensive phase, we have these drugs like the rifampicin, the pyrazinamide, ethambutol, and isoniazid. It is the 2 months treatment for pulmonary TB. And then for the continuation phase, it's about the rifampicin and the isoniazid. Guys, for the first month, we have the isoniazid. People experience the side effects of the isoniazid, so you have to give the pyridoxine to avoid those side effects. For the extrapulmonary TB, we have the 4 months course treatment for the intensive phase and 8 months for the continuation phase. The treatment, the drugs are the same, but the duration, it is what differs. Now we go to the complications for tuberculosis. The complication for tuberculosis, you may get the lung collapse. This TB mainly affects the lungs, so you may end up having the lung collapse. You may end up having the brain effects. You have the TB brain. You may have the side effects, the convulsions, loss of memory. You may end up unable to walk for the TB spine. So guys, that is about the treatment for that's about the topic on tuberculosis. Don't fear of getting TB. TB, it is treatable. Never fear it is a chronic. No, it is not okay, it is a chronic infection, but it is mainly, it has a treatment, guys. So when you go to any hospital facilities and if the doctor wants to screen for you for tuberculosis, guys, don't refuse. Kindly cooperate to be screened for the tuberculosis. Guys, next time we are going to learn about the tuberculosis and HIV positive patients. I'm going to give you the treatment for TB in HIV infections. Though the treatment is the same, but there are some drug adjustment for those people who are on ARVs. So guys, that comes to an end of our video today. Kindly don't forget to subscribe, liking the video and sharing widely. Thank you.